Hi, this is Kyle from Gateway Rehab, and we're here with Dr. Kirby, our medical director. We have a new segment entitled Ask the Doctor, and we asked for questions to be submitted, and we did have one question from Jim that we did want to address this month. It is Alcohol Awareness Month, so I feel like it is a fitting topic. Welcome, Dr. Kirby.
Thank you, Kyle.
The question we had online it was from Jim, and he wanted to know the difference between alcoholism and drug addiction.
Right. Well, thank you, Jim. I appreciate the question. So, it's interesting because alcoholism, drug addiction, in the form of opiate addiction, stimulant addiction, they all kind of work on the exact same part of the brain, our limbic system, our reward motivation pathway. And so from a biological standpoint, one drug is no different than any of the other drugs as far as alcohol versus anything else. But what we do know and what we can see is the behavior associated with opiate use is typically different than people who are using other substances. What we know is people with opiate use disorders their behaviors are a little more erratic. They're more likely to not finish treatment. They're more likely to have compliance and behavioral issues while they're in treatment. They're less likely to follow up to lower levels of care. They're less likely to engage in long-term recovery programming. So it's more of a struggle, to be honest with you, to change behaviors for people with opiate use disorder than with some of the other use disorders.
Now, would that be similar to some of the other substances, say cocaine or methamphetamines or things like that?
So the stimulants, cocaine and methamphetamine, do release more of the neurochemical dopamine, which does reinforce behaviors. But still, what we see is, even with the release of dopamine, opiate use disorder patients are typically a little bit more difficult as far as from changing behavioral standpoint than really any of the other substances.
So from a standpoint of treatment, let's get back to the question of alcoholism versus drug addiction. People with alcohol use disorder and people with opioid use disorder, do we treat them differently as far as treatment goes?
So as far as psychosocial modalities, it's fairly similar. What we do try to do here at Gateway Rehab is individualize a patient's treatment plan. So Kyle, if you were to come in or somebody else were to come in, then your treatment plan would be your treatment plan. It wouldn't be my treatment plan. It wouldn't be somebody else's treatment plan. So we do try to tailor to individualism as far as that goes. We do know that a lot of the psychosocial modalities that we use as far as 12-step approaches, cognitive behavioral therapies, dialectical behavioral therapies are very similar, and they do work across a wide spectrum of substances. Now, as far as medications go, there are different medications that are more helpful for opiate use disorder patients than for alcohol use disorder patients, and we do try to tailor medications based on the substance, the drug of choice. We also do have some medications that can potentially be helpful with some stimulant use disorder as well, whereas 6 months ago we didn't have a whole lot of options. So at the end of the day, the treatment plan is going to be tailored to whatever is going to give you the best shot at a sustained recovery.
Good. Well, thank you very much, Dr. Kirby.
Thanks,
Appreciate
Kyle.
your answer.
Appreciate it.
We'll have some submissions online as well. If you'd like to submit more questions for Dr. Kirby, please feel free to do so. And you can do that via our Facebook page or at recoverycommunity@gatewayrehab.org. Thank you.
Thank you.